Glenn Galton, Director of the Center for Global Health at the University of Pennsylvania Perelman School of Medicine. Our mission is to remediate disparities in the awareness, access, and provision of healthcare around the globe. We work in over 65 countries on projects that span health policy and outcomes, medical education and research, and hands-on care. Our partnership approach is highly collaborative. We recognize that our goals can only be met in context with the needs and culture of our global partners. One of our founding projects lies in Vietnam. We're partnered with the Vingroup Corporation to set a new standard for medical education in that country. This through creation of the College of Health Sciences at Vinh University. I'm pleased to announce that VinUni will welcome its first class of nursing and medical students and of graduate medical residents this October 2020. Penn's role was to guide in establishing the founding principles of the university, to assist in staff and faculty development, and to build the curriculum for our trainees in both undergraduate and graduate medical programs. Each of these to the highest standards of quality and of team-oriented educational principles grounded in rigorous competency-based training and assessment. It's been an enormous effort, one that relied on literally hundreds of Penn faculty, trainees, and staff. Of course, equally important are the links to our colleagues at VinUni and in the VinMech Health System, which will serve as the primary teaching hospital. I turn now to the leaders of our mission areas, Dr. Julie Sokolsky in undergraduate nursing, Dr. Gail Morrison in undergraduate medicine, and Dr. Lisa Bellini in graduate medical education to highlight the distinctive features of the VinUni medical training programs.
Hello, I'm Dr. Julie Sokolsky, the Nursing Curriculum Director for the Vingroup Penn Alliance. Baccalaureate nursing education requires an academic orientation through which students develop the ability to master analytic problem solving, to apply scientific knowledge, and to make evidence-based judgments that support the development of clinical nursing practice competencies across care delivery settings. The Vinh University Bachelor of Nursing program's curriculum has been developed to meet the standards of the US and international accrediting bodies and prepares its graduates for excellence in contemporary professional nursing practice. The program incorporates innovative pedagogy and contemporary educational technology as appropriate into the curriculum and ensures the curriculum is student-centric, flexible, and value-based. Development of the Bachelor of Nursing curriculum was an international and collaborative effort to establish a competitive and rigorous program infused with the social, behavioral, cultural, and epidemiologic determinants of health, along with community engagement to advance holistic patient and family-centered care, and to prepare nurses to provide care across multiple settings, hospitals, clinics, and in the community. This throughout the lifespan of their careers and across the continuum of care from prevention to end of life. The curriculum combines lectures, labs, simulation exercises, case studies, and small group projects with active learning methods for a comprehensive learning experience that builds critical thinking and problem solving. To date, the first 2 years of the Bachelor of Nursing curriculum has been created, which is focused on foundational science courses. These courses are integrated with clinical skills development, for example, anatomy, physiology, and physical assessment, to support the mastery of contemporary scientific knowledge and the methods to apply them to professional nursing practice. The curriculum also incorporates interprofessional training to promote effective team-based collaborative practice and prepare nurses who are leaders and change agents in health systems, nationally and internationally in the future. Principles of research and evidence-based practice are core features of the program, instilling in students the spirit of inquiry and striving for continuous quality improvement. The curriculum is the product of our strong partnership with Vinh University Bachelor of Nursing team, including both regular full-time meetings and subgroup working sessions on specific courses that has yielded a program to prepare nurses who will lead in improving the health of the Vietnam population and beyond.
I'm Dr. Gail Morrison, the Undergraduate Medical Education Curriculum Director of the Vingroup Penn Alliance. The medical school curriculum, developed with Vin University, integrates foundational sciences with specific skills and attitudes to prepare students to be competent in, first, application of medical knowledge, second, the provision of medical care, third, communication and cooperation skills, and fourth, the working principles of professional practice. These competencies will prepare medical students for any subsequent career choice from university and research organizations to non-academic institutions like the UN, the World Health Organization, or NGOs. To date, we have prepared years 2 and 3 of medical school. The VinUni curriculum contains all the knowledge, skills, and attitudes that provide the necessary foundational components in medicine required as preparation for clinical training. Foundational knowledge consists of not only core principles in basic sciences and integrative systems and diseases, but also technology for accessing information and newly recognized sciences of evidence-based medicine, research ethics, healthcare economics and law, nutrition and food hygiene, system-based practice, and fundamentals of population and health research. The skills of applying this knowledge will occur in active, small group learning sessions, utilizing case-based problem sets, laboratory demonstrations, simulations, and self-directed learning projects. The attitudes leading to professionalism will result from interprofessional experiences, working with each other in teams and developing their communication skills in both learning and applying knowledge. The key components of the curriculum include: 1, integration of knowledge, skills, and attitudes. 2, pedagogies that emphasize active learning, critical thinking, judgment and decision-making, and lifelong learning. 3, professionalism training and communication skills for multiple types of interactions. Assessment of these competencies is absolutely necessary and will include formative feedback on a daily, weekly basis, summative internationally accredited examinations, individual portfolios for each student that embraces individual paths to success. The curriculum content was benchmarked to the USMLE content outline for licensure in the United States of America and the Basic Sciences Exam Blueprint for the International Foundation of Medicine, IFOM. The curriculum is the product of over 100 Penn faculty and trainees. This was in addition to numerous joint Zoom meetings and in-person meetings with the VinUni Health Sciences team. All of us involved in the developing the UME curriculum with the VinUni Health Sciences team are excited for the official opening of the College of Health Sciences at Vin University. We know that VinUni students will be well on the path to successful medical careers.
Hi, I'm Dr. Lisa Bellini. I'm the Graduate Medical Education Director for the Vingroup Penn Alliance. The residency program curriculum developed with VinUni integrates foundational sciences with the knowledge, skills, and attitudes to prepare residents to enter independent practice in a variety of settings. VinUni Graduate Medical Education will include 3 residency programs: internal medicine, pediatrics, and general surgery. These programs will launch in the spring of 2021 after an intensive clinical skills curriculum that will begin this fall. The curriculum for all 3 programs are based on international evidence-based training standards that will train the future clinical leaders in academic medicine, produce highly competent and compassionate physicians who demonstrate professional excellence in all that they do, provide mentorship, coaching, and graded supervision by dedicated clinical faculty in order to help trainees develop into the next generation of leaders and educators, and provide structured assessment and feedback that are essential components for professional growth and advancement. VinUni residency training programs will use a variety of teaching modalities, including interprofessional teaching, longitudinal experiences, academic lectures and conferences, team leadership from the Medical Education Leadership Group, interactive social group learning, and scholarly products. Perhaps most exciting is the competitive recruitment process for the first class that occurred over this past summer. This included a robust application process using medical school performance, letters of recommendation, written responses to standardized questions, standardized video interviews, and the administration of the International Federation of Medicine's Clinical Sciences exam that was developed by the United States National Board of Medical Examiners and translated into Vietnamese. The first administration of this exam in Vietnam occurred in July 2020 and represented a large step forward to the introduction of standardized assessment. This 160-question integrated test focuses on clinical knowledge and clinical decision-making. This application process reflects the development and integration of robust standards for entrance into VinUni residency programs and sets the stage for the adoption of competency-based education and training in Vietnam. The intensive clinical skills course will occur over the fall and the winter of this year to ensure that all residents have the optimal knowledge, skills, and attitudes to enter residency training into one of our programs. The course will be taught by both Penn and VinUni faculty. We're extremely excited to welcome our new residents this fall and look forward to the continued partnership and collaboration with VinUni. Thank you.
It's now my pleasure to introduce Dr. Maurizio Trevisan, the founding dean of the VinUni College of Health Sciences. Maurizio serves as the lead individual for our relationship and has been a simply fantastic partner in this endeavor.
Here at Penn University, we are extremely proud of the accomplishment to date in establishing state-of-the-art curricula for the MD, BN, and GME programs. The presentations from colleagues at Penn have already provided detailed description of the monumental efforts we have undertaken to bring to Vietnam the highest standard of quality in medical and nursing education. We are eager and proud to educate the next generations of healthcare professionals that will be able to serve Vietnam and its citizens. We strive to educate compassionate and highly skilled and competent healthcare practitioners who understands and appreciate the need to address the healthcare need of Vietnamese through a team and competency-based approach. The leadership, help, and support from our colleagues at Penn has been instrumental in allowing us to pursue our dream to bring the highest and most modern academic standards to Vietnam and initiate a journey that in my mind will transform healthcare education. We are grateful for the help and look forward to many years of inspiring, fruitful, and stimulating collaboration.
There is, of course, still much work to be done in the years to come, but we are pleased to announce and congratulate the founding classes of Vinh University, guided by the knowledge, experience, and excellence of Penn, fused with the passion, dedication, and knowledge of Vietnam. In partnership with VinUni and VinMac, we aspire to the lofty ambition of transforming medical education in Vietnam. We are now well along the path to accomplish this goal. Please reach out to us at the link below with any questions or comments. Thank you.